Tuberculosis is an infectious bacterial disease caused by Mycobacterium tuberculosis that mainly affects the lungs, but can also impact other parts of the body, like the kidneys, spine, and even the brain. According to the World Health Organization, tuberculosis remains a significant global health challenge, with about 10 million new cases and 1.4 million deaths reported in 2020. There are many risk factors associated with tuberculosis. These include substance use, malnutrition, type 2 diabetes, HIV or AIDS, geographical location, chemotherapy, and even living in crowded spaces with poor ventilation. Tuberculosis is one of humanity's oldest diseases. There's evidence of a skeletal TB or pot disease in remains from the Neolithic era, ancient Egypt, and even pre-Columbian Americas. Therefore, if the disease has been around for so long, what makes this bacteria so special? This Mycobacteria is an obligate aerobe. That means that it needs oxygen to survive, and it's also a facultative intracellular parasite. Moreover, their cell walls contain something called mycolic acid, which protect the Mycobacteria from cell lysosomal attack. The mycolic acid component also helps retain a red dye after acid rinsing, which is the basis of the acid-fast stains used for pathologic identification. The infection starts when Mycobacterium tuberculosis is inhaled into the lungs. Then, the bacteria reach the alveoli, where they encounter something called alveolar macrophages. These are immune cells that act as the first line of defense. If these cells fail to destroy the bacteria, then it spreads into the lung tissue. This can happen either by directly infecting the alveolar cells or when infected macrophages move deeper into the lungs. Next, dendritic cells or inflammatory monocytes carry the bacteria to the lymph nodes in the lungs, where T cells are activated. This triggers the recruitment of other immune cells, including T cells and B cells, to the infection site, forming a structure called a granuloma. Inside the granuloma, the bacteria begin to multiply. If the bacterial growth becomes too high, then the granuloma can no longer contain the infection. The bacteria may then spread to other parts of the body, such as the brain. At this stage, the bacteria can also enter the bloodstream or even return to the airways, allowing them to be released into the air. The infected person now shows symptoms and has active tuberculosis, meaning they can transmit the disease to others. The clinical manifestations of tuberculosis include a persistent cough that lasts for more than 2 weeks, coughing up sputum, sometimes with blood, dyspnea, fever, night sweats, loss of appetite, fatigue, and even weight loss. The downside of tuberculosis is that it can happen anywhere in the body. This includes the central nervous system, the lymphatics, bones and joints, and other parts of the body. A chest X-ray is a cornerstone of diagnosis. If you find a patchy or nodular infiltrate, mainly in the apical or subapical posterior areas of the upper lobe, please think about tuberculosis. There can also be fibrotic scars, and pneumonia with hilar lymphadenopathy is indicative of primary tuberculosis. Tuberculosis is more common in the upper lobe because of 3 reasons. The first one is that there is a higher oxygen tension, which helps the bacteria survive, and there is a reduced lymphatic drainage and a decreased blood flow and slower healing, which help the bacteria spread and survive. Something that you should remember is that if there's a combination of these 3 symptoms, which are persistent cough that lasts for more than 2 weeks, unexplained weight loss, and night sweats, please wonder if your patient has tuberculosis. If you also have chest X-rays that showcase this type of pneumonia, please suspect about your patient having tuberculosis even more. Tests that we can use to diagnose tuberculosis. With a tuberculosis skin test, a healthcare provider is going to inject a small pre-measured amount of tuberculin PPD solution into the skin of the palm side of the forearm. This is sometimes called the MEN2-TST method. After 48 to 72 hours, the skin test reaction will be examined by a trained healthcare provider. That person is going to measure any swelling where the tuberculin was injected to determine if the reaction to the test is either positive or negative. Sputum can be collected and examined under a microscope for acid-fast bacilli. We need at least 3 samples. By collecting multiple samples, there is a great chance of detecting Mycobacteria, even if the number of bacteria is low in any single sample. We can also ask for a culture, but it takes about 6 to 8 weeks to grow enough bacteria to detect an infection. Chest X-rays can show lung abnormalities, such as infiltrates or cavities. Molecular techniques can detect the genetic material of the Mycobacteria. Immunological tests, such as the IGRA, can measure the body's immunity in response to mycobacterial proteins. Alright, now you know what is tuberculosis, what causes it, its clinical manifestations, and how to diagnose it. So, what's next? Maybe you can wait for the culture to be ready? Or should you start the treatment right away? Well, in Mexico, if the first series of the sputum tests are negative, then and symptoms persist and other diagnosis is confirmed, or the chest X-rays are compatible with tuberculosis, then you should request a culture and start the treatment. In the United States, there are factors to be considered to initiate empirical treatment for active tuberculosis, and these include a risk for progression, imaging consistent with tuberculosis, symptoms typical for tuberculosis, concern for loss to follow up, and high transmission risk. The treatment for tuberculosis consists of 2 phases, the intensive phase and the continuation phase. In the first phase, this one is used to kill actively growing tuberculosis bacilli and is crucial for preventing emergence of drug resistance. For most patients, it can bring relief from the disabling symptoms of tuberculosis disease. And the continuation phase is designed to eliminate the remaining tuberculosis bacilli and to reduce the treatment failure and relapse. The regimen for tuberculosis consists of isoniazid, rifampin, pyrazinamide, and ethambutol. And the intensive phase lasts 2 months, and the continuation phase either 4 or 7 months. And please don't forget that the side effects related to tuberculosis treatment can be severe, and they include things like hepatitis, peripheral neuropathy, and retrobulbar optic neuropathy. Other side effects include body fluids discoloration, flu-like symptoms, visual disturbance, and hyperuricemia. How do we treat drug-resistant tuberculosis? Patients with tuberculosis disease that is resistant to isoniazid can use a 6-month daily regimen of rifampin, ethambutol, pyrazinamide, and a later generation fluoroquinolone. Patients with multi-drug resistant tuberculosis disease must be referred immediately to an expert in the management of drug-resistant tuberculosis disease. This regimen should only include drugs to which the patient's Mycobacterium tuberculosis isolate is susceptible to. Also, a patient's treatment regimen may depend on factors such as patient preferences, harms and benefits associated with the drugs, ability to appropriately monitor for adverse effects, drug-to-drug interactions, comorbidities, and drug availability. Patients with active tuberculosis should undergo sputum analysis weekly until sputum conversion is documented. We should also check for baseline and periodic liver enzymes, complete blood cell count, and serum creatinine. After completing the treatment for pulmonary tuberculosis, patients remain at risk for late complications, including relapse, aspergilloma, bronchiectasis, bronchiolithiasis, fibrothorax, and possibly carcinoma. Thanks for watching. I hope this video helped you understand the topic a little bit better. See you in the next lesson.